everyone, I would like to continue further regarding the discussion of some of the important questions they might ask in the future or coming NEET PG exam. So let's begin with the question which is taken from the autonomic nervous system. So all of the following drugs used in the treatment of detrusor muscle instability except, that is the question. Option number 1 is oxybutynin, 2 tolterodine, 3 flevoxate, and fourth one is duloxetine. So this is the question. We have to identify the drug which is not used for detrusor muscle instability. Before that, I already told this is a question related to autonomic nervous system. So it is mainly divided into cholinergic, anticholinergic, adrenergic, and anti-adrenergic or adrenergic blocker. So now coming to this cholinergic system, you know that the principal neurotransmitter in this system is called acetylcholine, and it acts on the different type of receptors called cholinergic or cholineceptors. It is once again divided into muscarinic receptors and nicotinic receptors. But anticholinergic system, that is the prototype of this system, is called atropine. This atropine is mainly blocking these muscarinic receptors like M1, M2, M3, etc., and lesser affinity towards nicotinic receptors. But some of the atropine substitutes, they will also have the affinity to block these nicotinic receptors. They are called as ganglion blockers or neuromuscular blockers. Okay, so this cholinergic system is also known as parasympathomimetic drugs, or also known as cholinomimetic, because these are the drugs act similar way to parasympathetic system in our body. That's why we are called cholinergic system is also known as parasympathomimetic or cholinomimetic. So the drugs which block these receptors action like M1, MT3 are blocking the acetylcholine or its cholinergic agonist or anticholinesterases. They are called anticholinergic drugs, also known as parasympatholytic. That is parasympathomimetic. This is called parasympatholytic, also known as muscarinic receptor blocker, because mainly the prototype is has high affinity to block the muscarinic receptors. Some of its substitutes, atropine substitutes, they have the ability to block these nicotinic receptors, are called as ganglion blockers. So coming to this question, so they have given 3 drugs which is related to used to treat the detrusor muscle instability. So it is also known as overactive bladder. Okay, the important muscarinic receptor located in these detrusor muscles are M1 and M3. Okay, so what is this? In case of normal urinary bladder system, this detrusor muscle contracting when the urinary bladder is full. Okay, but in case of detrusor muscle instability, this detrusor muscle is contracting before the bladder is full. It leads to some of the symptoms called urinary urgency, frequency, and urinary incontinence. So it is almost always it is a contracting, that is detrusor muscle. So that is called detrusor instability, also known as overactive bladder. So among the options, oxybutynin, flevoxate, and tolterodine, these are vesicoselective muscarinic receptor antagonist. So anticholinergic drugs divided into natural, alkali, semi-synthetic, and synthetic compounds. In these synthetic compounds, these drugs comes like vesicoselective. They mainly preferably acting on the M3 receptor located in the urinary bladder system with additional smooth muscle relaxant property. So oxybutynin, it blocks M3 receptor present in the urinary bladder detrusor muscle, and it relaxes that, and once the bladder is full, then it is contracts. Okay, so it is helpful to treat overactive bladder. Simultaneously, second one is called flevoxate. It is also selectively M3 receptor, muscarinic M3 receptor antagonist. So it is used to treat overactive bladder. Okay, this flevoxate is also used to treat overactive bladder along with associated lower urinary tract infection. Okay, third one is tolterodine. This is also vesicoselective. It blocks M3 receptor located in the detrusor muscle, helpful for relieving the symptoms of overactive bladder, that is called detrusor muscle instability. Coming to the fourth one is called duloxetine. You know that it is similar pronunciation to flevoxate, tolterodine, etc., but it is not vesicoselective or M3 receptor antagonist. It is a SNRI drug. That is serotonin norepinephrine reuptake inhibitor. It is mainly used in the treatment of depression and efficacy is similar to tricyclic antidepressant. So this is the drug mainly used for major depressive disorder, and particularly this drug indicated in case of neuropathy associated diabetes, that is called diabetic neuropathy, first line drug. And second one is other types of neuropathy, fibromyalgia, and maintenance therapy in case of panic disorder. These are the important uses of duloxetine. But Tripathi mentioned that this duloxetine is also helpful in the treatment of stress associated urinary incontinence in the female patient because it increases the urethral tone. But among the four options, all three are the vesicoselective and particularly block M3 receptors in the urinary bladder. So duloxetine mainly antidepressant, and SNRI it is helpful for neuropathic type of pain. So duloxetine is the except in this condition. Okay, so this is about one of the important topic called anticholinergic system. In that, vesicoselective atropine substitutes mainly used in the treatment of overactive bladder. Okay, thank you.